But I think that the two most significant statements for the listener is that number 3 and number 4. Number 3 saying that we believe, after the research, that testosterone deficiency is a global public health concern. And this was back in 2015. I could tell you for sure that it's gotten worse. But then they followed up that statement by saying that testosterone replacement and people who were testosterone deficient is not only scientific and evidence-based, but also logical and safe, right? So that's a huge thing for us, especially you as an MD, when you're going to prescribe, that you are supported by the research that this is safe, effective, logical, and it's a medication that will enhance the person's life. Hi, everybody. Welcome back to another edition of Beyond Biohacking Brothers. I'm here with Miguel, my natural brother, and my adopted brother, Dr. Rudy.
Adopted right here.
And today we wanted to bring to you something that has been at the forefront of what we do, and it's gained a lot of popularity now that we've been seeing it for the last decade, and that is hormone deficiencies in our society. Doc, what the heck is going on? I mean, we've been 10 years at this. Can you tell us a little bit and tell the listeners what is the purpose of our hormones, what's going on, and what happens to the body when these things go awry?
Definitely, man. And yeah, we've been 10 years at this together, but I've been 20 years dealing with hormones and dealing with disease and bad health. And what we're seeing in our society now, it's truly an epidemic. Yeah. The levels of, and we're going to talk about all hormone deficiencies, but we're going to start with testosterone, because let's face it, we started as a testosterone replacement company. Yeah. We're way more than this, but testosterone remains almost at the core of what
undisputed
we do.
Contender.
Yeah. Because testosterone is what really helps human body function its best. And when I say humans, I just don't say men. We do a lot of men's health, but we also use testosterone in hormone replacement for women. Yep. But let's talk about the state of health in our society.
Yes, please.
And hormonal imbalance is a true epidemic. Low testosterone or hypogonadism is affecting a number of men that we never used to see that. Yeah. We're seeing patients in 18 years old, in their 20s, in their 30s. It's no longer an age requirement to require testosterone. And why is this happening? We're going to go over this ad nauseum, but no questions that it is our toxic world. Yeah. Because what's happened over the past 40 years, 50 years, is that testosterone level has dropped, 50%, 60%. Sperm count has decreased 40%, 50%. We're seeing muscle mass. We're seeing BMI go up. We're seeing like an increase in cardiovascular disease, in cancer mortality, in anxiety, depression, in sexual disorders, reproductive disorders. Something is going on.
We're going to die, bro. That sounds terrible.
It is doom and gloom
when
we talk about
doom and gloom.
But you know what's amazing? We can fix it.
Yes.
We can help fix it. So that's what I think makes us so amazing. Is we're not just going to talk about a problem. We're talking about a problem because we know how to fix it. Yeah. So when guys come to us, when people come to us and they have all this long list of complaints, Doc, doesn't work. I feel tired. This. So this is the list of complaints. By the time we do a follow-up in 2 months, then at 6 months, those are different individuals.
Yeah.
Right?
Yeah, 100%. And for you, for the listener, just so you kind of gain some clarity, number one, you're going to get a solution on what to do if you have some of these symptoms by the end of this segment. But, what I wanted to get into in terms of when we hear the word EDCs, endocrine disrupting chemicals, I know that this is something that, Rudy, you educated us on, because for so many years we were doing what we do and patting ourselves in the back and helping so many young men and women thrive, right? And we thought that we were, sort of superstars in the industry. And then all of a sudden it just kept getting worse. I mean, we saw younger and younger and younger people come, and more people. And that's when we really got into why the hell is this happening? And, you went did your thing, started geeking out, started researching, and you brought to the table Dr. Anthony J and Dr. Shauna Swan, who are incredible for anybody listening. If you want to understand why this is happening and what EDCs are and estrogenics and endocrine disrupting chemicals do to the body, I highly recommend either watching our interview with them or reading their book. But when you came to us and you showed us this, and this answered a humongous why was this happening? And I think that for everybody listening now, endocrine disrupting chemicals, thankfully we're becoming much more aware of them. I see them a lot more on Instagram, a lot more people talking. I mean, just this year alone, less than a month ago, they released a study where they found microplastics in all the sperm cells, testicle cells. I mean, imagine having plastic in your sperm.
How many people were tested in this?
I forgot the details, but it was almost 100%.
Yeah.
They found microplastic in every testicular cell that they tested.
Yeah.
PFAs, they found PFAs.
So
PFAS.
that's how you become infertile.
Yeah.
It just makes sense to become infertile.
It's one of the many reasons. Yeah. So not only they detected glyphosate and atrazine, which are the pesticides, in about 90+% of the blood of Americans. PFAS, which is another form of toxins, they detected in 97%.
But PFAS, I thought, are forever chemicals that have been banned, or no, we still have forever chemicals.
There's some that are banned, some. Right. But when we check the blood, that was a study, 97% of the blood. So now it paints a picture. Why are we so sick? Well, just look at what's inside our body, all the toxins that seeped from the environment into our body.
Yeah.
So no wonder we're that sick. But guys, today I think our first episode, what I really want us to focus on is hormones.
Yes.
We're not going to go into the why yet. Let's go into the what is the problem.
Yes.
How prevalent is hormone deficiency? Again,
53%. Let's just bring that big number, 53%.
Ramasamy, when we interview him, 1 out of 5 men between 18 and 39 years of age has a testosterone level under 450. And we know that under 450, most people don't have really good results. They don't have a lot of ammunition.
Well,
we've lost 53% of testosterone rates worldwide in the last 45 years of our human existence. I mean, 53%. That's more than half.
Yeah, that's more than half. Yeah. So that's why now, again, there's not an exact number, but the average 30-year-old, they are quoting everywhere, that has the testosterone of a 60 to 70-year-old man 50 years ago.
And they come with those complaints.
So let's go over the study that was done by Dr. Ramasamy and Dr. Lakeshwar at University of Miami. And again, this what gave us a leg to stand on when we see those younger patients.
Yeah.
Because again, I think everybody knows that low testosterone happens as you age. We use about 1% of our testosterone after the age of 30. So if you can kind of go down like this, it's pretty easy to realize if you're 50, 60 years old, you need testosterone. But what about the 20 and 30-year-old that are developing low T? So that study looked at exactly, it was called adolescent and young adult male, and they look at the age of 15 and 39, and they saw that about 20% of them met criteria for hypogonadism. And their symptoms of low T or hypogonadism started at a testosterone of about the 400, between 400 and 450.
These are teenagers that we're talking about.
Those are teenagers, 20-year-old, 30-year-old guys who are should be at the top of their game,
peak
the top of their
prime.
earning potential.
Yeah.
And if you have low testosterone, and remember, the average person, even the average physician, still thinks low T is just a question of erections, sex drive, and muscle. So they'll look at the average young 25, 30-year-old man who comes in, say, Doc, I'm depressed, I'm tired, I have no drive. They're like, but you have a beard, you have some muscle, you don't have low T. What testosterone does to the brain, to our personality, to our resolve, to our overall wellness is so much more than just sex and muscle. And when that happens to at a younger age, it is traumatic. It changes your whole outlook. As you were saying, having ED or having any kind of low testosterone hormonal imbalance at a young age, you don't know what to do. Then you go and you make an effort. That happens to our patients all the time. They go to their primary care doctor, they do a basic labs, they look at their total testosterone. They're like, nope, you had 350, you had 425, you had 268. Now 264 is the new normal,
right?
The lower limit of normal. Somebody comes with all the symptoms with those numbers, they'll tell him it's in your head. And the easy thing a lot of times for doctors to do is to hand out an SSRI, an antidepressant medication.
But then what we like to tell patients, okay, these reference ranges, where are they coming from? we already know that the testosterone reference range in this country was established through purely statistical means and have nothing to do with your health and longevity. And whether you're 25 or 80 years old, whether you hit the bullseye or the outer edge of the target, meaning whether you're at the bottom or the top, you're within the range, so you're normal. And the truth is far, far from that, where we can have somebody with low levels but no symptoms and cool. But we can also have a guy with low levels and be very symptomatic, as well as on the upper side.
Yeah. Well, don't get out of that
No,
point
I'm not.
yet.
I'm staying there. So the reference range, I also think, okay, let's look at the average statistic of what the American society looks like. 3 out of 4 Americans are overweight or obese. 1 in 3 have cardiovascular disease. 1 in 2 have prediabetes, diabetes, or insulin resistance, and 1 in 6 have metabolic syndrome, which is the gateway, basically, disease to every other disease. And we're fatter, sicker than ever. And what I like to say, we're malnourished, overfed, overstimulated, yet dopamine depleted, and a spiritually bankrupt society. We're being exposed to too many invaders, and we're not detoxifying fast enough, and hence affecting the hormonal system.
Yeah, completely.
And when to kind of, for the listener to understand the point about the reference range, when you're comparing yourself to a sick model, then you can't really call that normal. I mean, if that's normal, then our interests, and we're here to tell you that we want you to be exceptional. That's what the whole point of this podcast is. I don't want to be just below the pre-diabetic level to feel safe. I want to be athlete level, pre-diabetic level, right? So I think that's what the point of the reference range is. But going more to your point about the landscape of people that we are seeing with these hormone deficiencies, right? And what the effects are. And we're talking about testosterone today only because that's one of the lowest hanging fruits, both for men and for women. And I would offer to you listeners that the reason for that is because most people don't know that the most amount of receptors for testosterone in the body, the 2 biggest spots for testosterone receptors in your body is, number 1, your heart, and number 2, your brain. Which is why there's such an effect on your mood and your view of life when you are on testosterone. Not to mention the Urology Society's website. On their website, they have a guidance for all urologists in the nation, and they specifically say, article number 13, they say, if you have a patient who is low testosterone, and by the way, the Urology Society considers low testosterone a round number of 300, right? Now, the difference between 300 and 350, Doc, is materially insignificant. But let's just use the number 300. So there's a guidance for urologists to tell all urologists in the nation that if you have patients that are close to 300 or at 300, they are considered low testosterone and they have a higher risk for cardiovascular risk. What do you think about that, Doc?
Yeah, no, so there's a lot to unpack there. First, what I like with the American Society of Urology is now they added symptoms as a criteria to meet for hypogonadism. So American Urology Association, their numbers should be 300 or less. If it's below 300, you're hypogonadal, you have low T. Right. But also they put symptoms into consideration. They never used to put symptoms, which is great. You look at the American of Endocrinology Association, they did not put symptoms. Right. And their recommendations is has to be your testosterone has to be lower than whatever lab you're testing. So if you're testing LabCorp, the lower limit is 264. Wow. I saw another labs the other day, I forgot the lab, it's a private lab. The lowest number was 189.
No way.
So this is now where there's not even one number.
Yeah, who's making the decision?
Well, again, remember, the way they take numbers, so an independent lab who maybe has just 10,000 people, they'll be like, okay, on average, most of our patients are between this and that. So it depends on who you look at. Yeah. It should not be like this. So let me go over reference range once and for all. Yeah. Endocrinology, or the science of hormones, should have no reference range, no physiologic number, because we're also different. Yeah. The number we can say, okay, most people who have a number like this will feel good, will function well, but not everybody follows this. Right. So endocrinology should have never been a numbers specialty. Yeah. Should be a symptom specialty. Again, the way we used to treat hypothyroidism or low thyroid before we had a blood test for it, is that you do a differential diagnosis as a physician. I go and see a patient. I'm like, okay, tell me how you feel. They gave me a list of symptoms. I take those symptoms and I think about it. What is possibly create a cause of those symptoms? I come out with what is called a differential diagnosis. I'm like, okay, you're tired, you have low energy, you're gaining belly fat, and you have low sex drive. What are the possibility? It could be low thyroid, it could be low testosterone, it could be depression. That's my differential diagnosis. And then you're going to try to say, okay, which one is more likely, more questions. That's when you do blood tests. When they didn't have blood tests back then, somebody comes in with symptoms suggestive of low thyroid, you know what they do?
They give
him thyroid medication. They gave him the extract of thyroid. If the symptoms improve, I got my answer. So once we started having the blood test, now it's no longer the symptoms. It's are you within those numbers? Endocrinology should change that. Whereas this is really like the art of medicine, where you get a diagnosis based on a history and you do a therapeutic trial of that hormone and you see if the patient gets better.
Yeah.
They get better, you got your answer.
Yeah, but I think that, having a number also has its use. For example, if a guy comes back with a testosterone of 4,000 and tells you, Doc, I don't feel any different. It may not be the testosterone, it may be your thyroid, it may be your DHEA, it may be your adrenal function.
So that's how you're supposed to use the number, not just as a diagnosis. And no question that it's a diagnostic tool. So when I have a patient who comes in and tells me, because those symptoms are very non-specific, right? They're tired, they have poor recovery, decreased libido, they're hard for them to lose weight. There's 5 or 6 or 10 things that may be causing that.
Yeah.
So I'll do a blood test. If the testosterone is lower limit, that may be it. If the thyroid is abnormal, that may be it. If it's an insulin resistance problem. So that's when, once I have my symptoms, I already know in my mind what are the possibilities. Then you look at the numbers to kind of help guide you what is the most likely diagnosis. And we use number to guide your treatment. Once you put the person on treatment, I'm going to follow numbers. But even there, we see that. Some people do great with a testosterone of 700.
Yeah.
We have other patients, they're like, unless their testosterone gets on the upper limit, 12, 1400, that's when they feel good.
Yeah.
So the number's really just a guide. We use it as a guide, but it should not be the only thing that determines who's going to be on treatment and how much testosterone they should
I think
be
it's
on.
important to touch the average numbers. So back in the 60s, it used to be the average man had a total testosterone of 800. In the 80s, it became 525. In the 90s, it became 400, and after year 2000, it dropped under 350. And that, I haven't seen the measurements now. Nobody's done those studies. It could be
So where are we going to be in 2050?
Now, for the listener, think about that for a second, because you may be someone who's listening to us right now who knows what his testosterone number is, and think about that. The average 80-year-old guy was walking around with 800. Today, it's
100
hard.
years ago.
Today, it's hard to find a 35-year-old above 500.
No,
but
he says, Doc, my levels are fine. I'm
Yeah.
400,
Yeah.
but you're 40 years old
Yeah.
and you're half what the 80-year-old used to be. I mean, how is that normal?
But
It's
going
not
back to
even
what you
close.
said, Doc, I think that the problem is exactly what you said. I think that, and we touched upon this subject on our previous podcast where we talked about, the spirit of the healer being ripped out because of the machinery of the insurance game and, all the system, the medical system. I think that we've become a society that has gotten fixated on the numbers because it made it easier for a lot of practitioners. Well, if you're not in this number, I can't prescribe you.
Yeah.
So it made it easy. But, that culture, I think I agree with you, that it has to change because we have to, if not, we're just treating a piece of paper, right? So it's more about the symptoms more than anything else because just like you said, I mean, we've had guys that go from 300 to 700 and it's a life-changing event for them, their family, and everybody involved. Then we've taken people who are at 1,000 naturally and have every single symptom of low testosterone and we give them just a little bit and boom, right? Yeah. So yeah, definitely.
And now let's talk even the cultural ramifications and impact of low testosterone. What I like with what's happening, it's a lot more in the lay media, right? GQ came up with an article, I think 2 years ago, talking about testosterone as the fountain of youth. And they were describing people that were on testosterone therapy. Again, that's not what the average physician or the average person thinks about it.
Yeah.
I remember there was a 39-year-old that was a retired military, a veteran that used to direct men and came back. And then he found himself depressed, not able to lose weight, low energy. It was his testosterone.
Yeah.
So they talked about this. They talked about a 25-year-old who eventually opened his own low testosterone clinic because he went through it. We see that all the time. When I was growing up in medicine, the only people that I knew were doing optimization medicine, hormone replacement, were Sylvester Stallone, right? And look at him, he's still doing it now. Arnold Schwarzenegger. That was just a few.
Yeah.
So in our mind, it was just like the top 1%, the rich and famous who could afford this.
Right.
Now, so many people are on it. Jeff Bezos came out and admitted
God.
You don't
that
even
he
have
is
to
on
admit it, you can
testosterone
see
therapy. No, but what's good is you could see it. We knew. We're like, this guy's on testosterone. How do you go from, being
Looking like a tadpole.
tadpole to now you're looking like ripped? But it's great.
Yeah,
So
awesome.
now, health is the new wealth.
Yeah.
So now the best thing a guy can have, it's not just a $500,000 car.
Yeah.
Have a great body. Have great health. Right? This has become like a status symbol.
Financial, like logistics type of level. If Jeff Bezos got on, I wonder what what every other billionaire is thinking. Like Elon Musk is like, he's performing 30% better. How much better could I be performing if I get on therapy? If necessary, right? Because these people, we still have the motto, hey, run yourself to the floor. Go under 4 hours of sleep. No. If you're not getting proper sleep, proper nutrition, you are destroying your hormones.
Yeah.
And I kind of wanted just not to segue, but I just wanted to kind of have a little pause here for the listener who's listening and thinking, well, I may have low testosterone, or I'm feeling all these symptoms that they're describing, the lack of energy, loss of muscle mass, low ambition, et cetera, et cetera. Is there a natural way for me to do this? And I could tell you, look, because we see a lot of these influencers and, some doctors that go on Instagram and all these media outlets where they're saying, tan your balls, take some vitamin D and DHEA and whatever. Like, because of this endocrine disrupting chemical environment that we live in. I mean, I think that all of us three here will tell you that we wish that there was a natural way that we can do this. And by the way, for some people that could help.
For some
That
people,
could help. The vitamin D, the DHEA, you should
fix your sleep.
you should have that anyways. And if you want to go down the natural road, we're here to support you. Unfortunately, we're also here to tell you that there is a big monkey that people don't talk about, which is our environment. How we're being poisoned by not only the things that you're smearing on your skin, inhaling, eating, drinking, and your water supply. Obviously, our food supply and processed foods and sugars and oils and all that stuff, and then nutrient deficiencies. Right? Like, there is no question. Science has come to an agreement about that. We have lost 80% of the micronutrients in the soil all over the planet. To give you some perspective, you would have to eat 15 cucumbers today to get what our ancestors got out of one. So food is no longer enough. So we have these two huge problems that are against us, which are pretty much invisible because most people don't know about it. No. So for you, listener, are there natural ways? We hope that they work for you, but the vast majority of the times, at least from our experience, is pharmaceutical intervention, which, they're natural pharmaceutical interventions, but pharmaceutical nonetheless, because your body is just not naturally producing it.
Yeah. And you touched into something so important. Although we prescribe a lot of the hormones, our goal is make sure that you cover the basics.
Yes.
And even like one of the our next podcast is going to be talking about the 9 components of the wellness vortex that we came up with, including making sure you optimize your nutrition, your sleep, your exercise, your gut health, your cardiovascular health, your detoxification, your genomics, your epigenetics. We can have an effect on all those, your mindset, even your spiritual connection.
Yeah.
All of those things are part of what gets you to thrive. We address all of those. Of course, we have some patients that come to us and say, I just wanted to check my numbers, I feel good. And then we just put them on our nutrition program or sleep
just supplements.
Optimization program or supplement program. And that's great. But if you need, and we feel that you need testosterone replacement or hormone replacement therapy, we are the experts at doing this. And then we combine all the supplements and everything that I said here as a holistic approach to health. This is what differentiates us from the average low-T clinic.
I mean, low-T clinics, it's just testosterone, status quo, everybody on the same thing, 1 ml type of 200 milligrams per week. But the question is, if you bought a car, would you just put gas and not worry about the oil, tire pressure, all the other components that make that car run properly, right? So we like to say that when you come to us, if testosterone is needed, it's like upgrading the engine from a 4-cylinder block to an 8-cylinder block. But that engine is going to need some supporting parts.
Yeah.
It's going to need new valves, new spark plugs, etc., brakes to stop the engine, whatever it is. So testosterone comes with these other components, which we call the fundamentals. Typically, it's testosterone, vitamin D, magnesium, and essential amino acids.
Yeah.
And then when you keep upgrading, there's a lot more to the picture, but that's just what we would consider the fundamentals. So if you are on testosterone therapy and your doctor did not prescribe you magnesium, did not check your vitamin D and optimize it, and you're not taking some form of essential amino acids and not branch chain amino acids, essential amino acids, which are 8, debatable 9, depending on who you're talking to. So the point
He goes
is,
deep.
He goes right for the jugular.
why? Yeah, just making sure, because I'm all of that. No, and on top of it, what crap are you taking? Does it have fillers, binders, excipients?
Yeah.
I mean, most of the supplement industry is adding additives to cut costs, so you got to worry about that too, right? Yeah. So are you taking ethically made and pure pharmaceutical supplements that are supporting that therapy that you're on? And these are all the little hacks that we'll teach you as we go that we have mastered because we do them in our personal life.
Hell yeah, we do.
And we give our supplements to our nephews and nieces and grandma. I got our dogs.
Testosterone therapy.
Guys, let's talk about something else. And that study actually just came out.
Yeah.
Because I see that a lot, right? Sometimes I get guys, testosterone of 300
microplastic in testicles?
280. They feel pretty good, or they're scared of going on testosterone, although they have the symptoms. There's a study that just came out, and it just really kind of cemented all of those data. Is that low testosterone is an independent risk factor for cardiovascular disease and early mortality. Wow. So let me explain that, because that was a mouthful.
That was by who again?
Low testosterone. I don't remember the title, and we'll bring that study. But low testosterone has been shown to not only affect your personality, your muscle formation, your energy, it's an independent risk factor for heart disease and early death. So if you're somebody that you see your testosterone is less than 350, it's not just how you feel. It can impact your overall health, and it can impact when you're going to die.
Yeah.
Now, the second point to this, because a lot of people are saying, okay, I have low T. Okay, you tell me it's not just that I don't feel good, I need to worry about my longevity, but is testosterone safe? And I think we spent so much time talking about this, how really there was so much misconception when I went to med school in the 1990s that testosterone causes prostate cancer. We have a full video explaining the saturation model, the international consensus of physicians with the Mayo Clinic, the Cleveland Mayo Clinic
with
that
Harvard
got
University.
together and said testosterone does not cause prostate cancer. In that study, and there's another study called the Traverse trial that finally was a double-blind placebo-controlled trial where we put patients on testosterone and we followed them for almost 5 years, and they did not see an increase in cardiovascular risk and mortality. So we want to let people know this, that because my thing as a physician, first do no harm.
Correct.
I'm not going to give you something that I don't believe the studies don't support that it is safe. So when we decide to put a patient on testosterone therapy, it's because the studies support it, and the studies also support that low testosterone is not good for your
I mean, it's this simple. I actually looked it up the other day. NSAIDs, non-steroidal anti-inflammatories, kill about 16,000 people a year. Antidepressants, 5 to 10,000. Testosterone,
0.
give me the number. There's no number. So if they are killing people, where's the number? My kitchen cabinet pain med can cause much more harm than testosterone can.
Well, and you gotta say that, because no matter what, the average person, if there is a black box warning on testosterone, so if you pick up a testosterone bottle, you're like, oh my God, this compound may cause heart disease, and that was based on 2 studies that was done back in 2012 and 2013. The vegan study, his last name is
Finkel and Vegan.
Finkel and Vegan, and those studies were poorly done. They were retracted. We're not going to spend a lot of time talking about this, but that's why that Traverse trial that came out and showed it was a double, like gold standard, placebo controlled randomized study, and it showed no increase in cardiovascular disease or side effects. There were some side effects, but in overall, you can mitigate the side effects of
No, I love
testosterone
you.
replacement
I
therapy.
heard you on a podcast one time talking about that. For you to get like serious side effects, you would have to inject the whole body, like 10,000 milligrams.
Of course.
We
For
don't
you to
do
really
those.
have we don't even get to 300 milligrams if you're lucky.
And just to go back on the safety profile, because I think it's important for anybody, and first of all, for men and women listening, it affects both men and women, right?
Yeah.
The loss of testosterone, that's one of the first hormones we lose, and it affects us both equally, right? So, going back to the safety profile, I mean, this was, when you go back to the international consensus by the Mayo Clinic, this was a 35-year-long research study conducted by Dr. Morgenthaler, who was the chief of urology for Harvard University. So he did this for 35 years, 5 continents, almost 38 different fields of medicine, including urology and endocrinology. And like you said, they debunked all of these things. It does not cause prostate cancer, it does not cause cardiovascular disease. Actually, it's the other way around. But I think that the two most significant statements for the listener is that number 3 and number 4. Number 3 saying that we believe, after the research, that testosterone deficiency is a global public health concern. And this was back in 2015. I could tell you for sure that it's gotten worse. But then they followed up that statement by saying that testosterone replacement in people who were testosterone deficient is not only scientific and evidence-based, but also logical and safe, right? So that's a huge thing for us, especially you as an MD, when you're going to prescribe, that you are supported by the research that this is safe, effective, logical, and it's a medication that will enhance the person's life, for sure.
Another statement, they said also that age should not be a determining factor whether you meet criteria to be on testosterone or not.
Yeah.
The levels are not, age is not. You put all of this in consideration and you come up with a personalized plan to help the patient feel and live a better life. So that's what we do.
So I think that, just for the sake of time, for anybody listening right now, just know these two things. You have these two humongous monkeys you're battling against, which is endocrine disrupting chemicals and nutrient deficiencies, which we will get into in a further podcast. But based on those two things, there is an immense amount, an epidemic, as Dr. Rudy says, of hormone deficiencies. And if you are of my generation, I'm only 43 years old, or if you're of Miguel's generation, he's in his 30s, you're definitely being affected by this, because we were affected in our mother's wombs. And that's a fact, right? So based on that, we just want to give you an actionable plan. What is your actionable plan? If you're someone who's listening today who has heard us and has some of these symptoms, like lack of energy, lack of drive, sexual inhibition, a ton of different things that you heard us say today. What are your actions plan? You don't have to do it through us. I mean, you can call us and ask us what panels you should pull. We have instructed all of our coaches to give you this. If you call our company, get a proper lab done. I think that is the single best investment that you can make in yourself in 2024 is know where you are biochemically. Gather that objectable evidence. The numbers don't lie. And gather that evidence. And then, again, you don't have to go to us, but find a practitioner whose objective is to optimize you, not prevent you from dying. We know you're not dying, but optimize you, and have someone who can interpret these labs, educate you on them, and then come up with a realistic plan that will suit your lifestyle. I think that is the single best advice that I can give anybody today. Know where you are and have an intelligent conversation with an expert physician who can give you a plan to solve this and put this in the grave.
Great. And one thing I'm going to add to this, you said it beautifully, is ask yourself, are you satisfied with where you are?
Yeah.
So before you go with your numbers, do a self-inquiry. And I usually tell my patients, how are you feeling physically? How are you feeling mentally? How are you feeling sexually? How are you feeling spiritually? Once you have all of this, and I tell my patients, do from 1 to 10. Where are you? Our goal is 8 or 9.
Yes.
We're never going to be a 10 or maintain a 10.
Right.
Our goal is 8, 9, 9.5, and keep improving.
Yes.
So self-inquiry, then you check your data, then you come up with a personalized plan, and we can help with this.
Yes. Amazing. All right. Well, guys, we've come to the end of this podcast. Thank you so much for listening. Once again, if you have any questions, issues, concerns, we've trained our staff to answer all of those for you. So feel free to give us a call. You don't have to, hire us for anything. We could just give you advice and point you in the right direction. So if you liked this podcast, please make sure so that we can help many more people like us. Share, and follow us, whichever way you downloaded this. And until the next episode, stay healthy and God bless.
Bless.